Hello and welcome to the news review. I am Adebola Adeduba. Now, in continuation with the celebration of the Diamond Jubilee of the University of Lagos, which, by the way, is a year-long event across different faculties and institutes within the university, the celebration which was done at the Lagos University Teaching Hospital, Luth, Idiaraba, where the University of Lagos began, was tagged Touchdown at the Roots. Now, this week, it's a turn of the medical center as they celebrate their 10th annual medical week themed medication safety. Now, talking about medication, a whole lot of things comes to mind, especially as regards students. But we'll be doing that. I will not be doing that alone. I'll be speaking with the Deputy Chief Medical Officer from the Medical Center of the University of Lagos. We'll go on a short break. When we return, I'll introduce my guests. Welcome back. It's still the news review on Unilag TV. And like I said before, I went on that break. We'll be talking about medication safety. And I have Dr. Afolabi Adebayo, and that's the Deputy Chief Medical Officer of the Medical Center in the University of Lagos. Good to have you join us,
Thank
Doctor.
you for having me.
Now, I know as regards students, a lot of things comes to mind regarding medication. I mean, we have all sort of issues of health like STDs and the like, but I'm not getting into that. Now, regarding a prevailing factor is paracetamol, and I'm wondering, you as a professional, what's the medication safety surrounding the use of paracetamol, for instance?
Thank you. As you know, medication safety is just includes all activities to prevent, to avoid adverse reactions in the course of taking medication. If you come to paracetamol, it seems harmless. 2 tablets, that's 1 gram, 3 times daily. But if it's taken if it's taken an overdose of that, it could lead to liver disease, chronic liver disease. So too much of ordinary paracetamol can cause untoward adverse negative health for that person.
Okay.
Yeah.
I recall, back in my university days, I have an aunt, I hope she's not watching, she always self-medicates. What would you say is a danger associated with self-medicating?
Yes, that's one of the reasons why we chose this team, just to educate students and of course the staff at large. There are lots of dangers in self-medication. These drugs, as simple as good as they are potential poisons as well. If not properly used, they could cause grievous damage to one. For example, let me just give you an example. One of the drugs we call NSAID. It could be like diclofenac, felvine, simple drugs that they probably use for menstrual pain and all that. If too much of it is used, it will cause what we call gastric erosion, gastric ulcer, bleeding from the stomach, if it's not used according to instruction. And a lot of people come down with that, not knowing the implication of it. So we advise that before you use any medication, get a prescription. We know at times it could be time consuming at times waiting to see the doctor. I admit we have manpower challenge at the moment, but it doesn't cost you so much to wait, get your drugs at appropriate dosage and use as advised. And that will go a long way in taking care of the problem, not adding to the problem.
Okay, now talking about drugs, I know the late Professor Dora Konyuli did a lot in her time regarding we having original drugs in the system. But now that she's out of the picture, power has changed hands. I'm wondering and I'm thinking, what's the situation like right now? Do we still have a high influx of fake drugs? How is the condition of things right now?
I must say the regulatory agencies, actually NAFDAC, is actually doing a lot of work. The immediate past, I think she just retired now, Professor Adeyeye, Mrs. She's really did a lot of work, and they are really doing a lot of work on it, combating fake and substandard drugs. Even here in our center, because right now we follow the procurement process that we have them to, we do have control over those who bring the drugs. So each time they come here with what we do kind of a audit of this. If there's anyone where we suspect it's not working, we do an analysis. And we've done it twice, and so far they've not failed.
Okay, have you had any case whereby you carried out an audit and found that the drug was not original?
We didn't find any to be fake. The ones we did were found to be okay.
Okay.
The reason why we were suspected because it changed color. When it changed color, but the scientists said well, it may not really affect the content. But because of that, we were skeptical about using it. So we sent it for analysis.
Oh, okay.
But we found out it was okay.
Okay, let me talk about mistakes in terms of administering drugs. What gatekeeping mechanism do you have from the point of prescription to the patients who finally gets the drug?
Yes. There are rules, there are standards. The pharmacy, for example, they are laid down rules on what to give, and that's why the names are written on the pack, on the prescription envelope, apart from the drug itself. So it's the doctor writes out the drug. So at the time, the doctor probably mistakenly writes something. For example, let me give an example. Maybe out of exhaustion, wrote a paracetamol, 2 gram TDS, and the pharmacist doctor, no, 6 weeks back. Oh, sorry. You understand?
Okay.
That is one. Always checking because they also know the dosage of these drugs. The doctor knows the dosage, the pharmacist knows, so you correct it. Then, of course, when the nurses to look at it, look at this. So we look at it, we try and find a way of correcting ourselves.
Okay, let me talk to you about Dr. Falabi, the most prevalent challenge you have surrounding medication safety within the medical center.
Yeah.
What's your most prominent challenge?
The challenge we have right now will be availability of medication. That's
okay.
Yes.
When you say availability,
yes.
What you have now is not sufficient?
Yes,
okay.
I must say. But the management is working on it as usual because we are not we don't have total control over what it has to go through the management, goes through the university. So everything goes through your procurement process, goes through the university, goes to the vice chancellor for approval, before it gets to the bursary, before it gets to us. So they are working on it right now.
So when you have a certain number of patients and you don't have drugs to go around, how do you
what we do is
manage that
immediately
situation?
The director arrange for urgent emergency drugs. Each leader has a cap on what she can authorize.
Okay.
Now procurement that she can authorize, you can't go beyond a certain amount of money. So when we are in such need, so she make urgent request.
Okay.
Yes, to take care as a stock gap. Before now students were not around, so we didn't have much. So in the last about 6 weeks now, or how long? About 2 months now, we have staff, students on campus, so we have upsurge in care. So what she does is just to make sure we do the stock gap, arrange for quick procurement of the ones that take care of the immediate need, while we wait for the major supply approval from the management, probably major supply from management.
Now, talking about drugs, let me just get an insight into your world. What's the ratio you have right now of local drugs and imported drugs? What's the ratio like?
Wow.
Do we have more of imported drugs, less of the local drugs produced here? What do we have?
We have much more of imported drugs.
Okay.
Unfortunately, much more of imported drugs. Asia, from Europe, from Asia. We have some reputable local pharmaceutical companies here producing, but the gap is still more in favor of imported ones.
Okay.
Still much more in favor of the imported ones.
Okay, I know you talked about the audit process in terms of these drugs you get, but since now you mentioned we have more of imported drugs, How do you guys ensure the standardization of these products for your own safe use?
Yes, all drugs that comes to the country have to go through the regulatory agency. NAFDAC
Okay.
certifies them. So before we use any drug, that's been NAFDAC approved.
Okay.
That's the bottom line. That's the minimum. They must have been certified by NAFDAC. And at times when they come, we are not used to them. We want to see their certificate of, of the analysis in producing it before we actually start using it.
Okay.
So those are things we do, but they must have NAFDAC number. That's the bottom line. NAFDAC must have really certified them fit for use. Then, if you are not comfortable with it, they will request for their psychoanalysis. We'll look at it and see if there's a challenge. They will send for analysis.
Okay. Now let me talk about medical professionals within your field.
Yep.
On the 24th of October, the president of the Nigerian Medical Association, and that's Dr. Uche Ojima, in a press briefing said we have a case of over 10,000 medical doctors that has left the country. Now, a report also came out the same day from the NMA president in Taraba State, who said that there is a case such that one doctor attends to 10,000 patients. Within your profession, what do you think can be done to curb the, sudden exodus of our medical professionals in the country?
But it's a well-known fact that the government has not really been really taking care of the health needs of the populace. That's number one. I think number one challenge I think we have is the health insurance is not well entrenched in this country. Because it's not well entrenched, a lot of people pay out of pocket. And when you have to pay out of pocket for some things, it turns to prayers. Because when you have to spend all the money you have to take care of yourself, one, that could be very frustrating for the medical team. You want to take care of someone, no money, nothing. Some of the things they need are not available. And even the healthcare provider himself is not happy. He's not well motivated. So, they are what we call the pull and push factor. There's a pull factor. Come, we need you. Over there, in other places. And there's a push factor. We've been working, they've not been paid us some climbs, even in the same this government, the pay has not been so encouraging. So that's a push factor, discouraging factor, pushing people out.
Okay.
And other people are saying, we need you.
Right.
So
you've talked about the pull and push factor, paying out of pocket. What would be your recommendation to the government or to stakeholders to help improve the health sector?
Well, we really need to sit down and look at the way health is run in Nigeria. We need to sit down and see, one, health insurance should really be a factor, should be given priority across board, not just for the rich, not just for, right now health insurance, well, it's used in our institutions, but how many are compared to general populace? Even the institution, there are so many exclusions. This one is not covered, this one is not covered, so very discouraging. So that one will really help, because when you have health insurance, you have a lot of pool of money to get some equipment, to get some needed things. Then motivation of those who are doing the work, they need to be motivated, they need to get they need to be comfortable, let's put it that way.
When you say comfortable, I mean, break it down so you understand what you mean by that. They need to be able to
send their children to school.
Okay.
They need to be able to take care of themselves as well.
What do we have now in terms of benefits for health professionals? When you say they should be comfortable, I'm trying to juxtapose what is obtainable now and what it should be.
Let me give you an example.
Okay.
We've done with hazard allowance, for example.
Okay.
Our hazard allowance is just 5,000 naira per month. And it's been like that for more than 10 years, 20 years. Then we were on strike 2 years ago. Nothing came out of it. Then the government just brought out something, 40,000, blah, blah, blah. Even now, it's not been fully implemented. Just 5,000 naira for hazard of work. 5,000 naira.
And how far is the NMA that's the Nigerian Medical Association pushing for an improvement in
They've
terms
done
of
that.
welfare.
The last strike was actually aborted because of intervention, because the resident doctors were adamant about going, just like what happened with ASU. Nothing came out of it. So they now felt, instead of struggling, fighting themselves, then there are people who needed their
Yes.
service elsewhere.
You know, I'm
They're like,
tempted to
why
ask
why
you.
waste your time with fighting these people who are not ready to
Right.
budge?
You know, I'm tempted to ask you, how do you keep hope alive? You've talked about the poor wage payment, paying out of pocket, and no insurance services, you know, being able to cater to your family as a medical professional. But you are still in the profession.
Well-
So how do you marry passion and lack
Well-
of funds on the job?
Well, some of us have passion for the job.
Yes.
Some of us still believe in the country, no matter how bad it is. It will just be leadership problem, but some of us still believe. Not everyone think, you know, the grass is green over there, greener over there than here. We know it's not all 100% over there as well. There are challenges there. Some of us believe that it can still be better here. And some of us have other commitments that actually tied us down. I think that could be another thing. Some of us have
Right,
other
okay.
commitments that really are not allowing us to, you know, to do. Because, for example, in our setting, almost a third are out for one thing or the other. Maybe hospital, maybe study leave of absence, you know.
All right, thank you so much for
right.
your insight. And that's our show for today. It's been a pleasure speaking with you, Dr. Folabi Adebayo.
Thank you very much.
All right, the program is News Review on Unilag on TV. I've been speaking with Dr. Folabi Adebayo, the Deputy Chief Medical Officer of the Medical Center in the University of Lagos. You can watch all our episodes of News Review and follow us all across our social media platforms at Unilag on TV. I am Adebola Adeduba. I'll see you next time.